Ever wondered if eating for two is essential during pregnancy, or if flying is off limits for expecting mothers? It's high time for some myth busting. Pregnancy is filled with misconceptions and old wives' tales, leading to undue stress and unnecessary lifestyle adjustments. Debunking these myths quickly is crucial to prevent health risks and pregnancy. We aim to equip you with the right knowledge-informed decisions. From diet myths to stress-related fallacies, we're ready to tackle them all. Misinformation can be risky, so without further ado, let's dive debunking some of the most common pregnancy myths. A craving for sweets means you're having a girl, right? And surely you must eat double portions now. Think again. There's a common belief that your cravings can predict your baby's sex. Craving salty foods? It's a boy. Got a sweet tooth? It's a girl, but in reality, these cravings are more likely linked to the changes happening in your body, not the sex of your baby. Another prevalent myth is that pregnancy means eating for two. But this doesn't mean you should be doubling your portions. Your body does need additional nutrients to support your growing baby. But this usually translates to just a few hundred extra calories a day in the second and third trimesters. Eating a balanced and nutritious diet is the best way to support your health and your baby's development. So, don't let those cravings dictate your diet. And remember, eating for two doesn't mean doubling your portions. Exercise during pregnancy is a big no-no, isn't it? Or maybe not. Let's debunk some myths surrounding prenatal fitness. First, the idea that you shouldn't exercise at all during pregnancy is completely outdated. In fact, exercise can be beneficial for both mom and baby. It can help manage weight gain, boost mood and energy levels, and even ease labor and recovery post-birth. But what about yoga? That's always safe, right? Well, not exactly. While gentle yoga can be a great way to stay active and relieve stress, certain poses and hot yoga should be avoided. So what's the verdict? Moderate, low-impact activities like walking, swimming, or prenatal classes are typically safe bets. But remember, everyone's pregnancy is different. It's crucial to listen to your body and consult with your healthcare provider before starting or continuing any exercise regimen. Stay active, stay healthy, but always listen to your body and your doctor. Can the shape of a belly or the severity of morning sickness really predict your baby's sex? Let's find out. Over the years, countless old wives' tales have claimed to predict a baby's sex based on everything from cravings to the way a woman carries. But let's get real, these are just myths. No amount of sweet versus salty cravings or round versus pointed belly observations can accurately determine if you're having a boy or a girl. So, what's the real deal? Well, the only reliable methods to determine a baby's sex are medical procedures, such as an ultrasound, amniocentesis, or chorionic villus sampling. These methods allow doctors to directly observe or test the baby's genetic material. Ultrasounds in particular are a common and safe procedure often performed midway through pregnancy. They can reveal not just the baby's sex, but also provide important information about the baby's health and development. So let's leave the sex predictions to the ultrasounds, shall we? Does stress really harm your unborn baby? What's the real deal? Many myths revolve around the idea that a mother's emotional state can directly impact the baby's development. It's a common belief that high levels of stress, sadness, or anxiety during pregnancy can negatively affect the baby's health. But let's dive into the facts. Scientific research suggests that while severe and prolonged stress, such as that caused by major life events, can potentially have some impact, everyday stress and emotions do not directly harm your baby. Your body is remarkably adept at protecting your little one. However, chronic stress may lead to unhealthy behaviors like poor nutrition or lack of sleep, which can indirectly affect your baby's development. Remember, pregnancy is a time of significant change, and it's entirely natural to experience a wide range of emotions. So, it's important to take care of your mental health and seek support when needed. Your emotions are valid and natural, but they don't have the power you might think over your baby's development. Water breaking equals labor, starting immediately, correct? And instant bonding with your baby is a given, right? Time to set the record straight. First, let's tackle labor. It's a common belief that the moment your water breaks, labor begins in earnest. But that's not quite accurate. For many women, labor may not start until hours after their water has broken. And sometimes, medical professionals may need to induce labor if it doesn't start naturally. Next, the postpartum period. There's a widely held belief that mothers will instantly bond with their newborns. While that might be true for some, it's not a universal experience. Bonding is a process, not an event. It can take time, and that's perfectly normal. We also often hear that breastfeeding is easy and natural for everyone. However, the reality is that breastfeeding can be challenging for many new mothers. It's okay to seek help and advice if you're struggling. Labor and the postpartum period can vary greatly, so let's not set unrealistic expectations. We've busted some myths today, but the journey doesn't end here. We explored misconceptions, from pregnancy cravings to the eating for two myth. We revealed the reality of exercise during pregnancy and debunked baby gender prediction tales. We emphasized the importance of a mother's emotional health and dismissed unscientific old wives' tales. We clarified labor, illuminating the postpartum phase, demonstrating truth's victory over myths. Stay informed, stay curious, and when in doubt, consult a professional. Don't forget to like, share, and subscribe for more myth-busting and useful content.